Madam Chair. And I appreciate having the hearing, and I appreciate the work in this area, because this is something that affects everybody. And during the time I left the bench to run for Congress, and the time I got elected, I learned some valuable lessons about health care. I also had learned them as when I was in a small business myself as an attorney, but they became more pronounced. For one thing, I had a relative who was in a car accident, fault of another driver, so I agreed to help this person with their 2 days of medical expense, make a claim for the other guy's insurance company, and we did so. And the way the practice goes, you gather all available medical receipts. We did that, supply those to the car insurance company, and we had a settlement. And then under Texas law, once that's done, you can't distribute any proceeds until you pay back all of the medical, which I contacted the hospital, ambulance, doctors, MRI, all that procedures. And we had about $10,000 in medical bills. They all said, we've been taken care of pursuant to our contract with the health insurance company. So once I had all those agreements in, that they'd all been taken care of pursuant to their agreement with the health insurance company, all I had to do was pay the health insurance company. And for the $10,000 in bills, their total out-of-pocket was about $800. So it brings me to wondering, if there wasn't some way to get total truth about what procedures cost in cash. I'm told, I've not been allowed to see actual contracts, but I've been told that in some, perhaps Blue Cross contracts, there are provisions that do not allow hospitals or healthcare providers to charge a cash price that's as low as what the insurance company could get. I had a daughter that needed a procedure. We got a $200 discount for a $2,300 or $400 procedure, but I'm told that the health insurance companies pay a fraction of that, but they couldn't charge us that little because of their agreement. So it just seems that what we have in this country, everybody talks about health insurance, but most of what we have, other than the catastrophic care, is not health insurance. We have the insurance companies and we have the government running health care. And I also think for those who want to be entrepreneurs, since health care insurance has taken off so well, you could do the same thing with gasoline. The price is up, it's down. Tell America, you pay us a big wad of money every month, and we'll give you a copay and a deductible, and we'll pay your gasoline bill every month. It's the same type thing. It's not insurance as much as it is management. And so I would love to see us get back to the place where we were when I was younger, when you could have catastrophic care. Insurance did a phenomenal job of taking their monthly payments, depositing them, making them grow, and then covering catastrophic events instead of managing health care. I'd love to see us get back to a doctor-patient relationship that we don't have anymore. It's either patient government doctor or patient insurance company doctor. I want to see the health insurance companies do well and take care of us on catastrophes. The HSA seem like an avenue to address that, especially if it's pre-tax money, goes into account, can't be spent on anything else, can be rolled over and not one of these, if you don't use it, you lose it, could even be inherited. We could provide for future generations. Now, I have seniors say, I'm too old and I'm too sick to ever have an HSA. So we looked at numbers. We got 2006, and we're told that the federal government spent an average for households in America around $6,100 plus per household in America of tax dollars. That state governments spent around $2,200 or $300, about $8,400 per household. Heck, for that much money, we could tell everybody, here's your HSA if you're too sick and too old or out of work. Here's your HSA. Here's your catastrophic care. You're covered. And we save $3,000 or $4,000 of tax dollars if we did it for everybody in the country. And it would be back to a doctor-patient relationship. So I'm open to any proposals, but I'm not sure that we are back to where we should be where we can have a doctor-patient relationship. I saw socialized medicine in the Soviet Union when I was an exchange student there. I don't want to go there. Socialized medicine needs people to die before they get their care, so it doesn't cost too much. I don't want to go there.